Kia ora koutou katoa. Today I wanted to talk about knee pain and some simple things that you can do at home to help manage your knee pain. So one of the most important things that I find helpful is to recommend as much heat as possible. So having a hot bath, keeping your knee warm with wheat packs or hot water bottles is probably my top 2 or 3 pieces of advice with knees. So we want to be using as much heat as possible to keep everything nice and warm and manage swelling. So you can be doing that, 20 to 30 minutes on your knee and then 20 to 30 minutes off, and repeating it as much as you want to. Having a hot bath. When you're in the bath, you can throw some magnesium salts in there just for muscle relaxation also. And then you can be having your knee extended and flexed and just moving it through some nice gentle passive ranges of motion when you're in the bath. So sort of bending it and flexing it while it's nice and warm. My other top tip is to keep it moving as much as possible. So if you're lucky enough to have a stationary bike at home, or even a road bike, jump on that for 10 to 30 minutes every day, just to get that gentle range of motion back in that knee. Now, what we know about knees is that a normal amount of swelling over a 24-hour period is something to expect with knees if you've, amped up your exercise a little bit, done a few more squats than normal, or changed the volume or intensity of your exercise. So don't freak out if you notice that your knee's swollen up. What we want to make sure of, though, is that in that 24 hours, that knee pain and swelling comes down. If you're finding that you're having, knee pain and swelling that's lasting more than 24 hours, that's when you need to speak to your physio or your sports chiro. So just to re-emphasize those points, we want to be having hot baths, we want to be throwing some magnesium in there, we want to be trying to flex and extend your knee when you're in the bath. I find that helps just with relaxation and blood flow and keeping the joint warm. And then we want to be using wheat bags and hot water bottles to keep the knee nice and warm. And then finally, gentle range of motion with a bike, 10 to 30 minutes, stationary or road bike. And if you don't have either of those, then gently walking and slowly building yourself up. Most injuries are going to occur by doing too much too often. And that finally, an element of swelling for a 24-hour period is quite normal in the knees, but we want that pain and swelling to come down in that 24 hours. And if that doesn't come down, then do a teleconsult with your chiro or your physio, and they'll be able to give you some specific directions about how to help.